Today let's discuss the ulna bone. It is the medial bone of the forearm and it is homologous to the fibula in the lower limb. It has an upper end, a shaft, and a lower end. Let's begin with the side determination of the ulna. The upper end of the ulna resembles a hook-like structure which contains a concavity which is directed forwards. The lateral border of the ulna is a crest-like border and it is sharp, also known as the interosseous border of the ulna. The lower end of the ulna contains a styloid process which lies posterior-medially. This is the styloid process of the ulna. Let's talk about some of the features of the ulna. This ulna is of the right forearm. The upper end has two processes, the olecranon process and the coronoid process. The olecranon process projects upwards from the shaft and it has 5 surfaces: a superior surface, an anterior surface, a posterior surface, a lateral surface, and a medial surface. The anterior surface is articular and it forms the trochlear notch. Now talking about the coronoid process, it projects forward from the shaft and it has 4 surfaces: the superior surface, the anterior surface, the medial surface, and the lateral surface. The lateral surface of the coronoid process is flattened to accommodate the radial tuberosity of the radial bone. The upper end of the ulna has 2 notches, the trochlear notch and the radial notch. The trochlear notch articulates with the trochlea of the humerus, and the radial notch articulates with the head of the radius to form the superior radio-ulnar joint. Now moving on to the shaft. The shaft has 3 borders and 3 surfaces. The lateral border of the ulna is the sharpest border, also known as the interosseous border, because it gives the attachment to the interosseous membrane. Now this is the anterior border of the ulna. It is relatively thick and rounded. This is the posterior border and it is subcutaneous. It begins behind the olecranon process and extends down to the base of the styloid process. Now talking about the surfaces of the ulna, it has 3 surfaces as I mentioned earlier. The anterior surface is present between the interosseous border and the anterior border. So this is the anterior surface. On the upper part of this surface, we can see a nutrient foramen on the upper part. The nutrient artery is derived from the anterior interosseous artery. Now the medial surface lies between the anterior and the posterior border. This is the anterior border and this is the posterior border. So this is the medial surface right in between. Now moving on to the posterior surface, it lies between the posterior border and the interosseous border. So this is the posterior border and this is the sharp interosseous border. So hence this will be the posterior surface. Now talking about the lower end of the ulna, it has a head and a styloid process. The head of the ulna articulates with the radius and forms an inferior radio-ulnar joint. The head of the radius is separated from the wrist joint through an articular disc. The styloid process is present on the lower end, which lies posterior-medially. Posteriorly between the head and the styloid process, there is a presence of a groove. This is the groove. This groove is for the tendon of the extensor carpi ulnaris muscle.